Hello, everyone. We're so happy to have you here with us on the Stronger Marriage webinar produced by the Utah Marriage Commission, hosted by Utah State University. I'm Alexis Alcott, the UMC Interim Program Coordinator, and we're excited to have you join us as we celebrate 25 years of marriage celebrations in 2023. A huge part of that celebration is this webinar series that we put on every 2 weeks. So if you find any other things that you might be interested in, please check out strongermarriage.com to see other webinars that are upcoming. In today's webinar, we're excited to be joined by Jeremy Yorgason. He is a professor and associate director in the School of Family Life at Brigham Young University. He earned a master's degree from Kansas State University and a PhD from Virginia Tech with emphasis in marriage and family therapy, and was a postdoctoral fellow at the Center of Penn State. Dr. Yorgason teaches classes on adult development and aging, family stress and resilience, and advanced statistics. His research interests are focused on family relationships in later life, including couple relationships dealing with health challenges, grandparent and grandchild relationships, and family relationships in retirement. His recent published research explores how vision and hearing impairments are associated with cognitive function in later life, benefits of good sleep and exercise in later life couples relationships, and healthy ways that young couples manage type 1 diabetes. In his personal time, he enjoys going on walks with his wife, outdoor activities with his children, and growing trees from seeds. In this webinar, you will learn about the various forms of dementia, including Alzheimer's disease. You'll learn how a marriage relationship is infected when one of the partners develops dementia, how a marriage relationship is affected when a parent or one of the partners has dementia, tools and resources to help couples maintain and strengthen their marriage relationship while navigating dementia care. If you have any questions, please ask them by entering your questions through the Q&A function that's at the bottom of your screen. The chat will be turned off during the entirety of Jeremy's presentation, so this is really the best place to ask him any questions you might have. We will have a 15-minute Q&A at the end of the presentation, so write down your questions and save them for the end. If you have joined us for the CEU credit today, make sure to stay on until the end of the presentation. The survey needed for your credit should automatically load onto the screen, and then you'll receive an email from the Utah Marriage Commission with your certificate. You may also email the Utah Marriage Commission at marriagecommission@usu.edu to receive your survey on this webinar. Once the survey is completed on your end, you'll attain an email with your CEU credit certification. We'll now turn the time over to Jeremy for his presentation.
Thank you, Alexis. I appreciate it. I'm excited to share some information tonight about how dementia impacts marriage, and I suspect there are couples or individuals with dementia listening, perhaps professionals and educators that work with couples where one spouse, maybe even both, experience dementia. And I hope that you learn some things that will be helpful for you. I'll be sharing a lot of information. I would like to just give a brief overview about dementia. The bulk of my presentation will focus on when a spouse or partner develops dementia in later life. And then I'll also talk about how caring for an aging parent with dementia can impact marriage. Okay, so I'll jump right in. A lot of people don't know exactly how to think about dementia, like what is it? And I guess the way I like to think about it as an umbrella term that describes symptoms related to loss of memory, reason, judgment, language, these kinds of things that's caused by various illnesses. Alzheimer's disease, as you can see on the slide, is the most common form or the most common cause of dementia symptoms. And there are probably over 50 different causes of dementia symptoms. And so when you hear that someone, maybe a loved one or someone you're working with, has dementia symptoms, the first question probably should be, what type of dementia do they have? Because there are different treatments and outcomes and things like that. Okay, with Alzheimer's disease, there are three main changes in the brain that occur. The first is the formation of beta amyloid plaques. This is a protein buildup in the brain. The second is neurofibrillary tangles within neuron cells. And then because of cell death, brain atrophy, where you see the picture there, the actual brain gets smaller and ventricles enlarge. And so when an autopsy is done, these are the three things that are looked for to diagnose Alzheimer's disease. And I'll be talking a little bit more about the beta amyloid plaques in a minute here. When someone develops dementia, there's a fairly common progression where we see people having trouble in the beginning stages, keeping appointments, working with a telephone, making meals. It's really common to have challenges with math, even simple math, especially when that was a strength before. And then working with new gadgets like a new phone or new electronic devices, things like that just are very confusing for someone that has dementia. Here it's Alzheimer's disease, it could be any of those. In the middle stages, someone might start to have trouble taking care of their body, like dressing and grooming and bathing and things like this. Throwing things in the trash that might not be appropriate. I have a neighbor that had dementia, and they just had come out with the blue garbage can for recyclables. So we have a green can and a black can, and he got confused about these all the time. Every garbage day, we cleaned out each garbage can, trying to put the things in the right one. In the later stages, it's quite hard for someone with Alzheimer's disease or other types of dementia to walk, to eat, to take care of themselves in very basic ways. And so actually caregivers can help by helping their loved one to eat, feeding them, helping them to chew and swallow. They just forget these things. Dementia assessment should be done by a professional, and on one of the last slides, I have a link for the Utah Center for Alzheimer's up at the University of Utah. And that would be a great place to go for a professional assessment. That said, there are some other assessments that could be used I guess, basically to see what's going on. You could use the mini mental status exam. The 88 has 8 questions that tap into dementia symptoms. And then one of my favorites is the clock drawing test, where you invite someone to draw a clock at a certain time, and there are scoring systems and all of that. I have the 3 Ds up here on this slide because dementia, it can have overlapping symptoms with depression in later life and also with delirium, where sometimes someone that experiences depression might experience memory challenges. And also someone with delirium caused by a urinary tract infection in later life, by polypharmacy or medication interactions, or a post-operative stress. If someone didn't know, they might think that delirium is actually dementia. One of the best ways to differentiate these 3 is that delirium has an onset within 24 hours. It's very quick. Depression usually has an onset over a few weeks, and then dementia has an onset over months and years. Anyway, those are some tools that can be used and that have been used, especially in research. Let's see here. Okay, very briefly, I'll just mention that there are a number of things that we can do to help prevent. Now, we don't know the full causes of different types of dementia and Alzheimer's disease in specific. There have been connections with oxygen to the brain as of late, and so cardiovascular health can be really big. Diet, nutrition, lifestyle, doing these things can likely prevent. Now, if dementia is genetic, which in many cases it is, these things could help someone live with a higher quality of life as long as possible. There are certainly a number of things that are still under investigation. There are some medications that have been approved by the FDA to help with Alzheimer's disease specifically. Of course, each cause of dementia might have its own treatment. Most of these, Aricept, Exelon, Razodine, these ones are to address symptoms of Alzheimer's disease and may slow the progress of the disease. They don't always have a huge effect, but it may be noticeable and may be helpful for a person with Alzheimer's disease to take these types of medications. There is a new medication that was recently approved by the FDA that well, when people have taken these medications over a long period of time, they have fewer beta amyloid plaque buildups in the brain after taking this medication. And there's a hypothesis out there called the beta amyloid plaque hypothesis, suggesting that these amyloid plaques are the first stage in a cascade of things that occur with Alzheimer's disease. And so if indeed, that is a hypothesis, it's not been shown in research, but if indeed amyloid plaques are the beginning stages of Alzheimer's disease, these medications could potentially help. And so, yeah, there's a lot we could talk about with medications. I think I'll leave it at that. You would have to judge, is this helping? Is this right for my loved one? And sometimes it is, and sometimes it may not be. Okay, so when a spouse develops dementia in the early stages, they might simply feel like something is not quite right with their brain. It's not working like it used to. They may try and cover up symptoms or make other people think that nothing is going on because of embarrassment. They might be scared or feel dumb. Oftentimes we start to see changes in personality. So when you've known someone for a long time and now they're starting to act a little bit differently, that can be really hard. Is this the person I married? And especially if no diagnosis has been made and people are masking these symptoms or covering these symptoms, may not know what's going on. Now, people with higher education and higher IQ tend to do better on those tests that I showed you. And so it may be hard for someone to determine, do they actually have dementia? Someone may be able to cover up that way as well. And symptoms tend to worsen in the later hours of the day. That's just a thought thrown in there. This is probably the meatiest slide I've got here, although we've got a long ways to go. When a spouse develops dementia, I reviewed a bunch of the literature recently, and these are the patterns that are found in studies with couples where one spouse has dementia. And I'll say that most of the research is carried out with small samples and qualitative studies. So these may not be representative of all couples' experiences, likely are not. But I'll share these things, and if they can be helpful for you or someone that you're working with, then that's great. Okay, so many spouses are very dedicated and committed to being the caregiver, to serving their loved one with dementia. And sometimes it's helpful for couples to share memories of the good times that they've had over the years. Also, when couples have successfully adapted to stress in the past, that may help them to be able to connect during a stressful time when dementia is progressing for one of them. Now, as dementia progresses, as diseases progress, there are often changes in marital roles where the caregiver spouse gradually takes on more and more responsibility. Many of these responsibilities are centered around what we call instrumental activities of daily living. These are things outside of the person's body, but they need these things to live, like cooking and cleaning and paying bills, taking care of a home and a yard and these kinds of things. And then the relationship starts to differentiate even more as the caregiver starts to provide what we call activities of daily living, personal care like bathing, eating, using the toilet, getting dressed, these kinds of things. So there are a lot of transitions for a caregiver, and because many forms of dementia, and especially Alzheimer's disease, is progressive, usually this just keeps on getting more and more and more. Talk about what we can do about that in a few minutes. There are many losses that couples experience when one develops dementia. In the literature, caregivers are sometimes referred to as married widows or unmarried marrieds. They may feel very alone in the relationship. They may be grieving the loss of their loved one that's still alive, but there's a sense of loss and maybe going through stages of grief. There's changes in the quality of communication and certainly in intimacy. Some of the literature suggested that there can be a growth in emotional connection as physical intimacy may be declining, but couples may find other ways to be connecting in emotional ways. And my guess is most of this is in the early and middle stages of dementia. Not to say it couldn't happen in the later stages. There's also a sense of loss of the marriage, and this likely happens when a diagnosis is made. It could happen before that as symptoms are progressing, because diagnoses aren't always made early on. But the illness and its trajectory is often unpredictable, and so there's a lot of ambiguity. I'll talk about that again in a minute as well. The person with dementia often becomes a shell of the person that they used to be. Spousal caregivers, because point number one, they are dedicated and committed, they oftentimes spend their whole life, they give everything to care for their spouse, and often they neglect their own needs. And so there are a lot of losses, transitions, and commitment. And I will say that, you know, I'm painting kind of a negative picture, and I will say in the literature, there were stronger images and stronger words than I'm presenting here. Some people really struggle and have a very hard time with it. But I guess I'm leaning towards the positive side, that many couples manage and work things out in a way where they can still have a loving, happy relationship, even though it's very challenging. There are changes in sexual intimacy. With Alzheimer's disease, there is often either hyper or hyposexual urges. I would say typically lessened sexual urges, but sometimes not. Sometimes they are hypersexual images or sexual urges, and someone with Alzheimer's disease, new memories are not formed and kept. The part of the brain that stores new memories isn't working, and so intimacy may be happening and they don't remember, and so that can be hard to navigate. And sometimes when, even if a couple is not being sexually intimate, but one partner has sexual urges, they may be talking about it, they may be thinking about it, and then you never know what they're saying to other people about that. So that can be hard. And some forms of dementia impact the social filter of what's appropriate to talk about. and what we typically don't talk about outside of intimate settings. So, like I said, there's often decreases in physical intimacy. Caregivers are often exhausted. Many question, is it okay? Is it appropriate to be sexually intimate? My spouse is not the person they used to be. Are they there? Is it reciprocal? And they may just feel a sense of discomfort. And so that can be a challenging situation. Affection certainly can remain, but as the disease progresses, physical intimacy often changes. Let me share a couple of vignettes, a couple of scenarios. This first one, I put in parentheses there, ideal. Probably no one situation is exactly like this, but let's have a great situation to draw from, perhaps. Here we go. Arthur and Elsie had been married for 50 years. Elsie's mother and grandmother both experienced dementia symptoms in their later years. In the last several months, both Elsie and Arthur have noticed that her memory has started to slip, and that she especially struggles with retaining new information. That is, she remembers well her childhood and their early family life together. However, she has to be reminded to take her medications. She got lost while driving home from the grocery store last week. And when family visited her from out of town, she mistook one of them for a stranger being in the house. They went to a geriatric specialist who ordered some cognitive testing. Results showed that Elsie had the amnestic type, or a memory-related type of mild cognitive impairment. I haven't introduced what that means before now. Mild cognitive impairment is when people experience some dementia symptoms, but they're so mild that they don't warrant a diagnosis of dementia, but there are some impairments. And the amnestic type often leads over time to Alzheimer's disease. Other types may not. Okay, over the next 5 years, Elsie's memory continued to deteriorate. Arthur retired and spends his time caring for Elsie. They have a set daily routine. They avoid going out much. And Arthur helps Elsie with activities of daily living, such as dressing, bathing, meal prep, and eating, and so forth. Elsie's group of friends visit once a week so that Arthur can get out with his friends. The adult children take turns visiting Elsie on 2 other days of the week. Arthur attends an online support group of husbands caring for a spouse with dementia, and they have shopped for long-term care to know their options if needed in the future. And so I like that they have a network of care. They have a bunch of people involved. I like that there's a support group involved. I like that they've looked at long-term care options. There's kind of 2 ways families prepare for long-term care. One is they deny it and ignore it, or just put it off until there's an emergency, and then they go find what's available. And others might prepare ahead of time, do some shopping, find out what they actually want, and then as things get closer, they may transition into professional care in a facility. And my preference is the prepared approach, the shopping around approach, finding what you really want and not having to settle for just what's available when an emergency happens. But that said, I will say many families actually prefer the emergency model. They're not ready to move, they're not ready to do things, and that works too for many people. So I'll just throw that out there. Okay, let me share another scenario that is less common, but I have heard of this type of thing happening many times. Okay, Greg and Eleanor had been married for 40 years. They raised 3 children together and enjoyed their family relationships over the years. Lately, they have been having a bit of tension in their marriage. Greg was easygoing and a lot of fun to be around his whole life. But in the last several months, he seems to get upset quickly. He's not sleeping well. He has made calculation errors on some bills recently and just hasn't been acting himself. When questioned, he has responded defensively. Eleanor spent more and more time at their daughter's house, and after several attempts to resolve things, finally filed for divorce. She feels like she is married to someone totally different from who she has lived with their whole lives. 1 year after the divorce, the family learns that Greg has dementia, and looking back, it is now clear that he has been struggling with symptoms for the last few years, in fact, what likely caused the divorce. With support from their children, Eleanor moves back in with Greg and begins to care for him. They both wish they had known what was going on with Greg's dementia. Greg is grateful for the care that Eleanor is giving, and they enjoy the last 2 years of his life together with her being a caregiver. So we hear about a former spouse providing care and being the primary caregiver. Sometimes these couples even get remarried. I just heard of a situation like that just the other day. And sometimes they don't get remarried. There may be reasons for either situation. Yes, probably everyone listening here has a scenario that they're familiar with: a parent, a spouse, someone in their extended family, and so forth. And each situation is unique and needs a little bit of specialty care, you might say. Okay, so how does dementia affect a spouse? Let me first start with this question. Is the person with dementia to blame for their symptoms? We see this a lot in mental health, where there's a mental health challenge. Is that person to blame for their symptoms? That a spouse is forgetful, repetitive, distant, requiring a lot of work, sometimes demanding. I would say, okay, well, let's go back to the slide with the brain changes. And thankfully, we can place the blame on the disease. And it's sometimes helpful for caregivers to try and separate the disease from the person that they've loved, and to honestly, sometimes it's not until after the person has died and the caregiver has had some space and time to think about it, where they can come to the realization that was the disease. My spouse was somebody different, and they can work through that. Can couples be happily married when one spouse has dementia? There are lots of opportunities in caregiving for love, for service, for kindness, for patience, and these kinds of things generally are good for relationships. Judy Sigmiller, a friend of mine who is the author of her diary of her husband contracted early onset Alzheimer's disease, and she wrote about that in this book. She suggests that everyone should have an opportunity to be a caregiver because of the special closeness that can develop between spouses when this type of caring that is long-term, that is hard, but at the same time, it can be special in many ways. So I don't want to give a picture that this is all hard and bad, but actually it can be a blessing to relationships in some ways. Now, with dementia, the loss is ambiguous. Ambiguous loss usually is defined as, in this situation, a loved one being physically present but psychologically absent. In the literature, Bergman talked about the ambiguous experience of being together. And it's kind of interesting to think about, or hard to think about. I'm here with my spouse, but they're not here with me, or we're not really here together like we used to be. And actually, research suggests that caring for a spouse with dementia is the most difficult caregiving situation that you could be in as a spouse. That said, allowing a spouse with dementia to be involved in their decisions about their care as much as possible, and I would say this holds for parents, for a spouse, for anybody, letting them be involved, like what do they want, what are their wishes for their care, as much as possible, as long as they're not in danger, as long as they're not going to be hurt. Okay, so I've been doing some research with some students using the National Health and Aging Trends Study, and you can look that up on the internet. It's a national study of Medicare beneficiaries that is a longitudinal study. They've been collecting data for probably 15 years now, close to 15 years, and it has a partner study of caregivers called the National Survey of Caregivers, or the NSOC study. And we've taken data from care recipients from NHATS and matched it with a spouse in the NSOC study. So we have these dyads, these are married couples for the most part. Some of them are ex-spouses, like I talked about. Some of them are cohabiting, or most of them are married though. And among 580 couples, we've done some research looking at cancer and at dementia, and these two graphs show the differences between those. And let me just walk you through these. So on both of these graphs, on the y-axis, or the one that's going up and down, we see positive marital quality with lower levels of marital quality below and higher levels of positive marital quality up above. And then along the x-axis, or along the bottom, we have caregiver burden. And this is when the caregiver says, this is hard for me. And as you get further to the right, they're saying, this is harder for me. This is really hard for me. And if we're looking at the graph on the left, well, actually for both graphs, the red line represents the experience of people with the illness. So on the left, this is the experience of people with cancer. And on the right is the experience of people with dementia. And so on the left, we see that as caregiver burden goes up, positive marital quality, when a spouse has cancer, it does go down, but that downward slope is not as steep as if it's not cancer. And that is, in other words, when cancer is the issue, couples are able to experience still high levels of positive marital quality. On the right, in contrast, the red line, you see that as subjective burden goes up, positive marital quality goes down. So as a spouse is caregiving for their spouse, their partner with dementia, and the burden gets higher and higher and higher, their positive marital quality is decreasing. And that's a sad picture, but there are some things that we can do to decrease the burden of that spousal caregiver. So what can we do? In the early stages, as a couple, I say work as a team to fight the impact of dementia, learn about the illness together, go to doctor's appointments together. Okay, here's a gender difference. The spousal caregiving research suggests that when a wife is ill, husbands often step in to provide care. They serve, they interact in ways that they haven't done in the past, and this can be very meaningful to them. Husbands sometimes describe this as, I have this project and I'm helping my wife. And so that often generates greater closeness in the relationship. When a husband is ill, in contrast, wives often feel like they are now doing more of the things that they used to do, of taking care of someone or taking care of their environment. And so their stress often increases, they may feel overwhelmed, and can benefit from support, emotional support, instrumental support, all the help that they can get. And okay, some research suggests, so caring for an aging parent, there's different types of experiences than caring for a spouse. And I'll just focus on the spouse right here. When caring for a spouse, if the spousal caregiver is experiencing depression, heightened depression symptoms, heightened anxiety symptoms, they're going to have hard days no matter what. But if these symptoms are increasing, it's time to get other people involved and get them some support. More of what we can do. So like I kind of hinted at earlier, spouses often feel like it is my responsibility to care for my partner. I'm supposed to do everything. And so it's like a one-person nursing home run by one person 24/7. And and actually sometimes a spouse caregiver will die before the person they're caring for because they're exhausting themselves to give, because they want to, and also oftentimes they don't think they're a caregiver. They don't see themselves as a caregiver. They're a spouse, and that's what spouses do. So how can we help? Let's get a whole network of care. And I'm thinking of like a spider web. You've got adult children, friends, neighbors, church congregation, clergy, caregiver support groups, maybe some paid respite, adult daycare, if that's appropriate, maybe Meals on Wheels or other community resources, so that you have all these people helping out. And now it's not so burdensome to the caregiver. The other aspect that often gets neglected by spousal caregivers is to take care of themselves. How about sleep? How about nutrition, exercise, interactions that are with their friends and social things is important. And what spouses sometimes forget, or actually they're just so overwhelmed they don't even think about it, is that they could be a better caregiver if they're taking care of themselves. Okay, so transitioning now to when an aging parent has dementia. So when, let's say, my parent has dementia or my spouse's parent has dementia, now I may be driving to their house frequently, paying for more gas, or who knows, some of the bills. I may have less time to talk with my spouse, to go out with them and connect with them. Now there may be greater interactions with in-laws, and if in-laws are outlaws, or if sometimes there's friction between in-laws, and that can be hard. And if there's more interaction, that can be more hard. There may be more things to disagree about. People have strong opinions about care in later life. Caregivers are tired. They may have less time for their kids. And we sometimes talk about the sandwich generation, where a caregiver might be right here in the middle generation, caring for aging parents and for kids at the same time. The research shows that this sandwich generation is most affected when they're also employed. So they're working and caring for both generations, and it's just a lot. But there may be stress from caring for a loved one. Aging parents, someone with dementia, they may be difficult to care for. They may be disagreeable. They may be demanding. They may not appreciate the care that's being provided. And that's really hard for adult children. Usually adult children say, I'm going to let somebody else do this, when that starts to happen. But there's grieving, there's loss of a parent in a challenging way. And someone that's a caregiver for an aging parent with dementia might feel torn between all their different responsibilities. So it's not easy. And a famous book that's used, I'll show you it on the next slide, the 36-hour day, suggests that couples should make time to regularly talk and communicate, make time for their relationship with dates, anniversaries, things that they've always done together. Do those things. You've got to keep nurturing. You can't just put your marriage on the back burner for a few years and expect it to still be alive. It's like plants in Utah in the summertime with no water. You gotta be feeding it and watering it regularly. As a couple, it's important to make decisions about what resources are used together. So how often are the visits going to be to care for the aging parent? How much money will be spent? What other resources will be needed? What kinds of things will we need from the other spouse to fill in while the one spouse is gone caring for their aging parent? If couples can be unified and make those decisions together, there will be less resentment over time as things get harder. They usually get harder with caring for someone with dementia. When spouses have differences of opinion, I'm suggesting that we lean towards the opinion of the biological relation. So if it's my parent and I have a strong opinion about something, I would talk to my spouse and say, hey, could we do it this way since it's my parent? But let's say those differences of opinion persist, maybe get a third person involved, get some professional guidance. And I just get a third opinion, I think could be helpful. Well, not a third opinion from your best friend who also thinks just like you, but maybe professional opinion, because maybe there's an imbalance there. Here's some great resources. Okay, so this is the website here for the University of Utah Center for Alzheimer's. I can't remember the exact name of the website, but if you go there, it's if I have a loved one who's experiencing dementia and I want to know what their diagnosis is and what can be done, I'm going there. If I suspect mild cognitive impairment, I'm going there. And I'm sure there are other geriatric specialists all throughout Utah, probably in southern Utah, Utah County, probably a little bit along the way. It is a little hard to find a geriatric specialist. You may have to travel a little bit. This isn't the only place you could go. And there probably are a lot of resources up in Cache County as well. Northern Utah, there probably are. I'm just not familiar with them. A lot of times people ask me, what is a good book? I'm caring for my aging parent. This is the best one I found out there. It's more like a reference book. It's not one you read from cover to cover, but you just look up, here's my situation. Okay, I want to find out about that. And then the 36-hour day I mentioned, this is the book if you're caring for someone with dementia. Now, it's kind of daunting. Think about this. What if every day had 36 hours? We would be exhausted, and that's what it's like caring for someone with dementia. And then Life with Big Al, like I mentioned earlier. Okay, so I think that's the information I have planned. I'll go to my thank you slide. I'll back up to this other issues slide as well. Happy to address any of these or questions that people have.
Perfect. Thank you so much, Jeremy. So make sure to go ahead and put your questions in that Q&A function down at the bottom of your screen. We do already have one question that says, how do you tell a medicine works for somebody with dementia if they can't communicate that clearly with you?
That's a great question, and it's one that I've wondered about as well. There is a fair amount of skepticism about these medications. I will say that I had a friend that had Alzheimer's disease, and he told me he was taking this medication, and I asked him, do you feel like it helps you? And he said, absolutely. I feel like my memory's working better when I take this medication. I'm like, okay, well, I can't argue with that. And most of the medications are approved for early stages of Alzheimer's disease. There are 2 medications that are approved for middle and later stages, but when someone is going to be less likely to be able to tell you if they think it's being helpful or not. But it's really hard to tell. I wish we had a better answer. The truth is we've spent a lot of money as a country and a world trying to medicate or trying to solve and heal Alzheimer's disease and other dementias, and we just don't have the answers. So I would say consult with doctors, ask the person if you can, see if you notice a difference, and make the best decision that you can.
Perfect. The next one says, what should I do if I notice dementia signs developing in a friend, but I'm not their primary resource?
Well, that's hard. I guess nobody wants to have dementia, right? But everybody wants a friend. And so I would say just try and be the best friend that you can be. And if your friendship is in a place where you could say, have you been having trouble with memory? Or I've noticed this, have you had any medical care in this area? Or like, I don't know exactly how to broach it. You could potentially, let's say, the spouse of that friend, you could contact them, but making a triangle isn't always the best route. So yeah, I don't have a great answer to that. My friend that had Alzheimer's disease, I just let the family figure it out, even though I was seeing symptoms. I didn't go to the family and say, hey, your loved one has Alzheimer's disease, or I think they have dementia. But I might say, hey, I noticed this about this friend of mine. I was kind of surprised. Did you know that, like the garbage can issue, did you know that we go through the trash every week because it's going in the wrong can? Have you noticed any trouble with memory? But it's a sensitive topic, certainly. Actually, let me just say one more thing about that. People often ask, how do you know if memory changes are dementia versus just normal aging changes with memory? Because we do experience changes with memory with age. We don't have as good of memory as we get older. And a lot of older people worry, oh, I'm developing dementia. I forgot something. I forgot where my car was parked. I can't find my keys, can't find my phone. These things are really typical for everybody, right? But what about forgetting the name of someone who lives with you, or getting lost in a neighborhood that you've driven in for 50 years, or these kinds of things? It's when you lose the familiar, that's when you probably ought to look into things.
Thank you. The next question is from somebody who is a child of their parent who has dementia. And they said, what should I do if my siblings and I disagree with the care being given from the caregiving parent? So they said, in parentheses, their mom.
Okay, yeah. So this happens all the time. So you're not alone. Adult children have varying opinions. Ideally, back up 10 years and your parents express to you, here's the kind of care we would like in our later years if we were not able to voice that for ourselves. And they share that widely with the family so everybody knows. Let's say in your situation, you have a spouse that's providing care. Some of the siblings think, oh, I'm so grateful for what she's doing. I'm glad that she's doing that, and that's a lot, we're not having to do all of that. But others are saying, gee, dad really needs this, this, and this. How come that's not getting done? I'm frustrated about that. So it's hard. It's hard. Family meetings are recommended. The 36-hour day recommends having a family meeting where you talk about these things. And actually it has some guide questions and how to navigate it. I will say that not all families should have a family meeting where everybody gets together. Like, it could create a lot more conflict. If you're going to work things out, it's great to do that. If there's going to be a lot of conflict, sometimes it's better to do those things one-on-one. Say, let's talk through this. If you don't think that mom is providing the right care, well, let's talk as siblings. Let's have let's go out to lunch and talk about that. Why are you worried about that? What are you concerned about? Do you have any solutions to recommend? And I would say I kind of go like my fallback, and I've never been a caregiver of a spouse with dementia, but my fallback is that person in danger? Are they being hurt? And if they're not being hurt, then we let them and their spouse decide what they're going to do. If their life is in danger, if their well-being is in danger, then maybe it's time for someone else to step in and help out. And it may be that this mom doesn't have that network of all of these resources helping, and she is doing too much, and because of that can't do more. I don't know, of course, the details of that situation, but good luck with that.
Thank you for that advice. The next question is, how do you navigate taking away responsibilities from a spouse who's always done those roles prior to their diagnosis?
Okay, so I think what we're talking about here is sometimes when someone's developing dementia, let's say that they're having dementia symptoms, or they've been given a diagnosis of some illness, but they still have a driver's license, but it's not safe. Or they have access to bank accounts, but they're not making wise choices. And sometimes family members have a hard time. They don't want to be the bad guy, and especially a spouse who has to live with them. There could be major repercussions if the spouse says, you can't drive anymore, and sorry, but you can't spend any of your money that you earned throughout your life. So those are really tough situations. And I would say get a doctor involved if you can, to take away the driver's license. That doesn't necessarily stop driving, but it can really help. Another one, actually, the thing that I've seen is most effective with driving is you say, I'm uncomfortable riding with you because I'm scared and I'm worried that you could hurt somebody else. The comeback is usually, well, I don't care if anything happens to me. Like, I don't care if I crash and die, whatever, but what about other people? What if you were to hurt somebody else? And nobody wants to hurt someone else. And usually that's where they start to realize, okay, I probably shouldn't be doing that. These are difficult decisions to have, and um, you know, all throughout, whenever new limits have to be set or changes occur in a home, if you can express love, I care for you, I care about you, I'm sorry that this is so hard, oftentimes that goes a long way.
I love that. Thank you. The next question is, why do you think relationship satisfaction decreases more with a psychological issue over a physical one?
And I assume you're referring to the cancer versus dementia slides there. So cancer is kind of unique in that couples oftentimes are fighting it together. They're being unified against this thing. And oftentimes people with cancer have their cognitive capacities up until near the very end, whereas someone with dementia, okay, so the average length of time that someone from a diagnosis until death, I would say, is 8 to 12 years. And if someone's being well taken care of, could be 15 years, 19 years. Like, we're talking about many, many years. And slowly the person is losing capacity and becoming less of who they were. And so I think it's the ambiguity, like, this person's here, and I'm doing a lot of work, but they're actually not here. A caregiver might not feel like they're actually married anymore, and yet they're married. So they can't go out and make new social relations. Some do, but it's just very difficult. So that would be my explanation, but I appreciate that question. It's and probably each situation, each type of illness can be unique, but we do see these patterns with there. There's a lot of people that experience dementia, and rates are going up as we have people living longer.
The next question is, what makes a good care facility versus a bad care facility?
That's a great question. Well, care facilities will want you to be their client. So from their perspective, they're all good facilities. And most are, I guess. I don't know. So I would say two things that I would look for. One is, you're going to go visit facilities and you're going to see, would this be a comfortable place for me? Would this be a comfortable place for my loved one? A lot of it might be personal preference. Some people prefer a small care facility with fewer than 10 residents who receive a little more personal care, and it might look like a home and home environment, that kind of thing. Other people might prefer something that looks or feels more like a hotel with nice meals and lots of people and lots of activities scheduled. And so there is some personal preference involved. I personally, okay, so one thing that you could look for across the board is staff to patient ratio. How many people do they have caring for how many residents they have? And the people in charge of these facilities know their staff to patient ratio very well. They may not want to tell you what it is. And the government has certain low level limitations, like you have to have at least this level of care. But so I would look for that ratio, but also I'm looking for someone who likes to be with older people. There are many people who love older adults and they love taking care of them. And just like you would at an elementary school, you'd want a teacher who loves children. And there are some people that are involved in care of older adults who really don't want to be there. They're doing this for a job, and they may be overworked and underpaid. So I would just, ask them how much they like their job, and how's it going with the residents. You'll see them calling them by their names, helping them, noticing their needs without the resident voicing those needs. These are things that are kind of intangibles, but I guess it's a little bit like car shopping. They're all going to sell you a great car, but you want to kind of find what would work best for you, and you certainly don't want a lemon. And they're all very expensive. I'll just note that, and the prices are just skyrocketing, thousands of dollars a month. It's crazy. So you keep up your care as best as you can at home, and people they tend to do better at home. That said, there are a few situations where at home means isolated and lonely and not having all of their care needs met, and in a facility means all care needs met. Now they have a social environment, so that can be helpful in some ways.
Thank you for sharing. And this will probably be our last question, is how do I handle first a very resistant caregiver, and they put in parentheses, someone who doesn't want help from community, and two, a resistant, and they said patient, but a person who has dementia, and they don't want care to be given to them. So kind of a two-part question.
Yeah. Okay, so a spouse wants to do all of the care. They don't want someone intruding, and they have their privacy in their own home. They know how they do things, and now you're going to bring someone else in who's now going to start doing things in my home, in my environment, and that can be very intimidating and hard. And caregivers may one day feel like they really need outside care, and the next day feel like, no, I got this. And on the outside, the adult children might be thinking, help, we need some consistency here. We need our loved ones' needs to be met. And so it's a tricky balance there. I guess, I think you can ask some frank questions like, are you, as a caregiver, are you getting the sleep you need? Are you getting the nutrition that you need? Do you have social interactions that you need? And they might have certain preferences. They might say, yep, I'm great. And if you believe they really are, if you think they're not, you might say, well, here's some indicators that make me think that you really could benefit from some help. And then also addressing, what about the needs of this person that you're caring for? If their needs are not actually being met, that's where they might be willing to get some help. Like the care recipient, are they getting the nutrition that they need? Are they getting the social interaction that they need? Are they, medications? Are they getting their medications on schedule? Correct doses? Who knows? It can be hard to navigate that, and one possibility would be to say, well, could we try something? Could we try this help from outside agencies, and let's just see how it goes. If after a few weeks you don't want this help and you don't need it, then that's fine. But let's give it a shot. Care recipients, if they don't want the needs, if they don't want the help, then I say, as long as they're safe, as long as they're taken care of, I'm fine with that. They get to choose. But if they're actually in danger, now I'm saying, well, actually, it's time that someone stepped in, and those are hard conversations.
Well, thank you so much for sharing something you're obviously so passionate about, Jeremy. And thank you everyone for coming and participating and bringing some really good questions to the table tonight. We're so grateful for that participation. Once again, if you did attend this webinar for the CEU credits, make sure to stay on until the end of the webinar for your survey that will automatically load onto the screen. Or you can email into the UMC email, which is marriagecommission@usu.edu for your survey. Upon completion, you will get a certificate back from us. Have a great night, everyone. Thanks so much.
Thank you.